It's Lisa from Been There, Got Out. And today's guest's name is Laurel. She is a therapist, and we are going to be talking about one of our favorite topics, trauma. She's trauma informed. There she is. She knows a lot about. We are going to be talking about effective trauma therapies for people getting out of high conflict relationships. Oh, great. I can see you, Laurel.
Hi.
So I'm so glad that we're going to talk about this because we haven't talked about, I mean, trauma is like present in everyone's
Yeah.
life, or I at least in our community. But before we
hmm
even start, is it common in general? Like you always hear trauma,
Oh,
you think
yeah.
of something extreme.
Yeah. I mean, the definition of trauma has changed so much in the last 100 years. I mean, 100 years ago, people thought only combat veterans could experience trauma, and it was called shell shock, right? So this was
Mhm.
World War I veterans coming back, and they thought that, okay, this is only something that people with a military history experience. And then as they started researching it more and more, they're like, huh, okay, people who've experienced sexual assault and sexual abuse also have these symptoms. And it just keeps expanding to the point where it's pretty universally recognized everyone has trauma. It's just of varying degrees, right? So something as, kind of innocuous as being forgotten at school as a kid
Mhm.
can be traumatic, the way your brain experiences it. It's just the emotional experience and the perceived threat of something, not the actual objective danger. So by that definition, everyone has trauma. It's just, it become actual PTSD? Not always, but it affects us, right? And certainly with this population that we're talking about, I would expect to see high levels of trauma and high levels of PTSD.
Yeah, and when you just said the two words perceived threat, I've never
Mm-hmm.
heard trauma described as that. And that is
Mm-hmm.
something thousands in our
Yes.
community are dealing with
Yeah.
because they're dealing with a very difficult
Yeah.
ex. And our clients, we specialize in something called legal abuse, where their ex is
Yeah.
using the legal system to wear them down and bleed them dry. There's a
Yeah.
constant sense of dread of like, if I'm not perfect, if my kid
Yeah.
scrapes his or her knee, like I'm going to get in trouble. So it's like they're
Yeah.
living with ongoing trauma. But before
Yeah.
we keep talking, Laurel, how about you officially introduce yourself?
Yeah, so my name is Laurel Roberts-Meese. I'm a licensed therapist. I work primarily in California, but I'm licensed to see people in California, Florida, Michigan, and Washington State. And I have a small team of therapists that I've handpicked that we work mostly in California, also a couple other states, and we all specialize in trauma. The people that I pick, either they come with a extensive history in treating trauma, or they go through training in a specific modality I'm really eager to talk about because it's so effective at treating trauma. So this is our bread and butter. This is what we do. Not specifically just legal abuse and escaping relationships with domestic abuse, but all kinds of trauma.
Mhm.
I have a long history of working with people who have experienced sexual trauma, and some of my staff have their own little niches as well.
Yeah. Oh my gosh. Well, I'm going to pick your brain.
Yeah, go for it. That's
So,
what I'm here
yeah.
for.
All right. So, speaking of brains, how does trauma affect our brains? I know I've heard about the
Mm-hmm.
amygdala and the sheath and it's
Mm-hmm.
worn down, but you know
Yeah.
way more than me. So, what happens when we experience
Yeah.
different levels of trauma to our brains?
Absolutely. Well, yeah, I know that earlier on in my career, anyone started talking about neuroscience and using the word amygdala, and I would just kind of like glaze over.
Mhm.
But what you're talking about is that like really like primal part of our brain. The amygdala is the fight or flight center that is, like its job is to keep you alive. So when you are in a situation where you are like, oh, this is not safe, your amygdala lights up and its only focus is how do we survive this,
Mhm.
right? And so you can't be thinking creatively when you're in amygdala override. You can't be like, oh, what do I want for dinner? It's just like, how do I get through the next 30 seconds to 5 minutes, right? So it's very short term thinking, and you can feel kind of cut off from yourself because you're just in this survival mode. And I think a lot of us know know what it's like to be in survival mode for a long period of time, and coming out of it can be it can be confusing. Like, is it safe to kind of relax back into my broader brain? And you may find yourself kind of going back to behaviors, coping behaviors and thought patterns when you were in survival mode, because that starts to feel like the only thing that is safe, even if you are objectively and subjectively now safe. It can take a long time for your nervous system to recognize that, oh, okay, we can relax. Like, it's okay to sleep through the night now. It's
Mm.
okay to, like, stay vigilant, but we don't need to be hyper vigilant anymore. And we can just see that nervous system staying activated for a very long time. And it's exhausting to be that activated for that long, um, and scary for your nervous system to be that activated for that long.
Yeah, as you're talking, I think about how I spent 10 years in the legal system and represented myself for 7.5 of those, and like about 100 court appearances, and felt like it was never going to end, and
Yeah.
always lived with Chris and I, my partner, came up with the term Friday night bomb, because it was like you never knew when someone was going to file another motion. They love
Mm.
to do it on a Friday night to
Yeah.
ruin the weekend, or right before a vacation, or right before some
Hmm.
special event. And so I found myself, even when things were quiet, I'd
Yeah.
get more scared because I thought something's going to happen. And our
Yep.
clients feel the same way. It's like the silence
Yeah.
scares me more than anything, because I don't know what's coming, but I know
Yeah.
it's something bad.
Yeah. It's really interesting just how we adapt and get used to the new normal. A lot of people that I've seen a good number of people who grew up in a really chaotic household and kind of had just chaos was their baseline. They seek out a kind of like thrilling or chaotic career as an
Oh,
adult because it's
I thought you were
normal
going to say
for them.
relationship.
Well, that could be too, but it could also be a career like being an EMT or first responder, or someone who is really like professionally often thriving because they're used to that level of intensity, and that they feel very uncomfortable when things are steady and static,
That
you
is
know?
really interesting, because I'm thinking
Uh-huh.
about, I mean, we have hundreds, we work with hundreds of people from different parts of the world, men and women, and a lot of them have very high powered careers.
Yes. Uh-huh.
But also we have a number of them that are like nurturers. We have loads of nurses
Hmm.
and teachers and people
Yeah.
in those helping careers.
Yeah. Which those are also chaotic careers, right?
Yeah, yeah, yeah.
Talk about it, that kind of like unpredictability, being a nurse or a teacher, that'll
So
do it.
interesting.
Hmm. Yeah.
Wow.
And uh, you might say that if someone has done the healing work, that they've kind of like transmuted that trauma and made it
Hmm.
a superpower, that they can be in these chaotic environments and thriving and helping others. And I would just hope that they are also making sure that when they're off the clock, they actually get to enjoy their leisure time, and they
Hmm.
actually get to, experience that calm in a way that over time they learn is okay and not scary.
Very interesting. I'm not going to make this about me, but a lot of what you're saying is really
Mm-hmm.
resonating,
Mm-hmm.
um, just just personally.
Yeah.
One thing that I wanted to ask you about, because we just got off a call with someone who, and this we see a lot, where someone has been out of the relationship for years,
Yeah.
and they're still completely traumatized,
Yeah.
crying, like life is
Yeah.
ruled by the trauma, and then they feel bad because
Yeah.
they're saying it's been this many years and I'm still like this. What's wrong with me? If it's been,
Mm.
let's say, 6 years, it's never going to get better.
Yeah.
And I'm
Oh, there's
talking to
nothing
you,
wrong
Lisa,
with
right
you.
now, and here I'm still feeling like terrified. So I doubt that you can help, but I don't agree with that.
No, nothing's wrong with you, right? There are many reasons that someone might develop PTSD and someone else would not in the same circumstance, right? There's nothing wrong with you. I like to say, sometimes we need medical intervention. Let's say we need a round of antibiotics for an infection or a cast to set a bone, right? Similarly, sometimes the brain needs a medical intervention to just kind
Mhm.
of rewire and get back to a baseline where you just feel like, yep, I can face the day, right? And one of the most effective ways of doing that for PTSD that I use is it's called EMDR therapy, which is, you know, a very research backed. It looks and sounds totally weird, but every time I go into an EMDR session, I'm like, well, okay, I hope this works. And then the client experiences some, you know, healing, and I'm just like, oh, yep, it worked again, even though it's this weird modality. And I like to view it as that like antibiotic or that cast to set the bone. Because just like the rest of our body, our brain and our mind, it wants to heal. It doesn't always have the tools to do it on its own. So
Mhm.
there's nothing wrong with you. The same way there's nothing wrong with you if you need a medical intervention for something.
Yeah. So EMDR is something we're familiar with, but some people here might not know what it
Yeah.
means, and it involves
Hmm.
the eyes going back and forth. Can you just talk
Yeah.
about it a little bit?
Yeah, so it was developed in the 80s by Dr. Francine Shapiro. She was thinking about something upsetting that happened to her while she was on a walk, and she was moving her eyes side to side on the path, and she found that this upsetting thing stopped being upsetting to her.
Hmm.
And so she went and for the next few decades researched it aggressively and found that the eye movement, you can do eye movement. We also do tapping side to
Hmm.
side. There are many ways to do it, but it's the side to side stimulation that triggers the brain storing the memory differently
Hmm.
on both sides of the brain, more like a typical memory. Like if I asked you to describe your last trip to the grocery store, you might have a little difficulty recalling it because it was probably unremarkable.
Right, right.
So, it stores a trauma memory a little more like that, and it really just cuts the connection between the physical trigger and the memory, right? So it's not that you're okay with it happening. It's not that you're glad that the horrible thing happened. It's that you really believe, not just in your mind, but in your body, that you're okay now, even though it happened. Because that's the thing. We can tell ourselves over and over, like, I'm okay now. But if your body is still activated, it doesn't matter if your brain believes it, right? You have to get your
And
body on board.
yeah,
And
and
that's
that's
what
the thing.
EMDR does.
Yeah, we have we one of our old clients from a few years ago came back,
Yeah.
and she was saying, I feel like I know, like my I know in my mind
Yes.
what these patterns are, and I still get so upset. Like I still fall in,
Totally. Yeah.
I can't help myself.
Well,
So when
you
you were
can't
talking,
help having a reaction to something that your brain now is experiencing as happening again.
mm-hmm,
Right? You get into a neural network, which is like a little cluster of memories and sensations, and your brain feels like it's happening again, even if you logically know you're here right now. Your brain is experiencing it as happening all over again. And EMDR just goes in and helps you correctly store it in a like, oh, that's in the past.
yeah. So
Hmm.
my partner Chris did EMDR
Hmm.
a little bit before COVID. And I feel like he had like only one or two sessions before everything shut down, and
Mm.
it changed everything.
Yep.
It was
Yeah.
like this memory that he every time he thought about it, he would become terrified, and
Hmm.
it sort of numbed it. So it's like he
Yep.
could now think of it, and it
Yep.
doesn't really bother him. It's almost like
Yep.
there's that emotional detachment.
Yep, totally.
Yeah.
That's the
So,
sign of successful EMDR. And
oh my
sometimes
gosh,
people
but
aren't
so
sure if
fast.
it worked. Yes.
I
Hmm.
couldn't believe it. It was
Yeah.
less than 2 hours, two sessions, and
Yeah.
then pretty much
Yeah.
gone.
That is remarkably fast for EMDR. I would expect, particularly for complex trauma, which relational trauma is complex, I
Mhm.
would expect it to take quite a bit longer. I think maybe he's probably an EMDR super processor,
I don't
someone
know.
that just can go through super fast,
Well,
right?
it was one particular memory. They were like
Yeah.
one particular. It wasn't like a whole
Hmm.
general like the relationship
Yeah.
of 14 years.
Right. Yeah.
Yeah.
Well, yeah, those isolated incidents, those do go faster for sure. It's just so rare that something is actually an isolated incident,
Yeah.
particularly when we're talking about relational trauma, because something that a partner does could remind you of a caregiver or a
Hmm.
teacher or something, and it's part of a larger web. And EMDR can target that. It just takes a little longer.
Yeah. Well,
Mhm.
another thing that I learned recently is something called bilateral movement, which I
Mhm.
guess EMDR is part of it. And is that where you're
Yeah.
using like both sides of your body? And so
Mhm.
things like walking, where
Yep.
you're using both sides, and there's something called bilateral playlist where there's music that I guess
Mhm.
activates both sides of your
Yep.
brain. And yesterday I was taking a walk with my son, and he was saying how he loves walking. We've always done walks together, but he does lots of long walks on his own now, and he said he always feels better. And I was talking to him about it. I said, I wonder if it's part of that is that
Mm.
bilateral movement that naturally it's
Yeah.
the back and forth, and so it's calming everything down.
Yeah. I think probably so. I'm not familiar with the research, but I would suspect that we're seeing higher rates of PTSD these days because we have more sedentary lifestyles,
Oh,
right? I would be
interesting.
really curious to see people that walk a lot or people that are doing bilateral movement like exercise or
Mm-hmm.
I mean like swimming.
Mm-hmm.
That I would be interested to see rates of PTSD and how they differ. Like if there was a way to do like a controlled study. We do know that when someone is experiencing a trauma, if they have control over their body and they can move, much less likely to develop PTSD. PTSD is something that develops after like the 30-day mark if you're looking at an acute trauma. And we do have some research around like natural disasters, people that had to be airlifted out of a disaster zone if they were kind of like strapped down
Mm-hmm.
as they were being airlifted, high rates of PTSD, where people
Oh,
could walk or run and like had some physical agency, lower rates of PTSD.
that's making me think of athletes. Like maybe
Hmm.
athletes can heal better if they're doing so much physical activity.
Yeah. Hmm.
I mean,
Yeah.
in my own life, I felt like after in the last part of my marriage when it was the hardest, and then throughout the whole court stuff, and still now, I started doing something different. Like I started taking kickboxing and hip hop
Yep.
dancing, and I feel like that saved me
Yes.
by doing that. And I didn't have to talk
Yeah.
to anybody for that first
Hmm.
year, and then I made friends. But just that back and forth movement, I never realized that perhaps part of it was that bilateral movement.
Yeah. Yeah. And it could be the bilateral. It could just be that, like, it turns out exercise is really good for our brains.
Hmm. Right, and the
It's
pleasure
really good
hormones,
for,
right?
yeah, it's good at like helping with delaying dementia onset for older adults. It's like there's no downside to movement. I think
Hmm.
that where we get into tricky territory is the kind of like diet industry and like kind of shaming fitness culture that
Hmm.
really doesn't align with what we know all the mental health benefits are. So people kind of associate exercise with like it's got to be this extreme thing. It's got to be all the time. It's like it needs to be hard. It can't
Hmm.
be fun. And I'm just like, no, it actually has to be fun. It has to fit into your life. It can't feel punishing. It needs to align you with your body. And if you're doing it for those reasons in that way, you're going to see incredible benefit in your life for your mental health and your physical health.
Yeah, like taking a walk with a friend or someone that you care about is
Yeah.
that's exercise, and
Yeah,
that's really healthy.
absolutely. And a lot of us, like we get up, we get in our car, we drive to work, we go into the office, we sit at our desk. Like there's very little movement. And just small and like adding little bits of movement here and there, I think really helps when we are in a rough spot in terms of going through a trauma, coming out of a trauma.
Uh-huh. Oh, that's great. That's great to know.
Mhm.
Okay, so what are some misconceptions people might have about trauma? So we talked about how it doesn't just happen to soldiers.
Yeah, it's that like everyone that experiences trauma develops PTSD. That's not true. PTSD, I anticipate that there will be just a continuing expansion of the definition when we're talking about like actually clinically in the diagnostic and statistical manual. I think we're going to see an expansion of trauma diagnoses that really capture how people actually experience it. So right now, the only diagnoses we have are acute stress disorder and PTSD. Acute stress means something happened within the last 30 days and it's really impacting someone. But not everyone that has acute stress disorder is going to develop PTSD. Like, I think we can all think of something that happened that like really shook us in the moment,
Mhm.
but then over the next few weeks, we kind of got back to our baseline and we're fine.
Yeah. Yeah.
And uh, I will say that if something really jarring happens to you, your best bet to prevent PTSD is to get into EMDR therapy right away, right? That there's actually a protocol that helps like prevent it from escalating, which is great. Um, but you know, people think like, oh, so next point, next misconception about trauma, that PTSD is, you know, only something that happens right after and then just kind of fizzles. No, we see PTSD sometimes showing up years after something has happened.
Really.
And people get really frustrated by that. They're like,
Mhm.
I thought I was good. I've been
That
out of there
I
for a
see that
while.
all the
Like,
time. Yeah.
why now? I'm
Yeah.
good now. And that's probably because your nervous system has probably finally gotten to a place where it can actually relax, and that it feels safe enough
Hmm.
to start working through some of these neural knots that are in your brain. And it's very frustrating because you've likely worked very hard to get out of the situation and to kind of rebuild your life. So seeing PTSD showing up years later, totally normal and very treatable. But if it's showing up years later, probably not going to spontaneously resolve. So you will need to do something
Yeah.
to help move it through.
As you're talking about that, it makes me think about why we get sick when we go on vacation. Like, now I can finally relax,
Great
and
analogy.
I'm getting a cold.
Yeah,
It
great
sounds similar.
analogy. Yeah.
Yeah.
Mhm.
Wow. So, so when you said about starting EMDR or some kind of trauma therapy sooner rather than later, I remember hearing from a couple of our clients who went to a therapist, the therapist saying now is not the right time to do EMDR because you're still in the midst of it.
Yeah.
So can you talk about that? You know, if I'm
Yeah.
still in the midst of it, because a lot of our clients with the court stuff, they're still in the midst, but
Yeah,
it takes a long
totally.
time.
It does take a
So
long time.
yeah,
Well, I'm recalling that, and I actually have done some consultation around this, that there are some situations in which going through trauma therapy may result in a lower financial settlement if you're looking
really,
at emotional harm. Although I've talked to some lawyers who are like, yeah, if you don't get treatment, then the judge is going to ask like, well, why didn't you treat the PTSD, right? And so you would just want to like get some clarity around that. But yes, sometimes EMDR is not a good idea if you're not able to ground yourself. And EMDR can be very vulnerable, right? You're going into treatment with someone you've just met. You're talking about the most upsetting things that have happened to you, and you do have to fully access the memory. And
hmm,
if you're not in a place where it's safe and advisable to do that, then yeah, it's not the right time for EMDR. I will say my biggest pet peeve and the biggest red flag with EMDR is a therapist that does not spend any time on resourcing. So, resourcing is the preparation phase where the therapist helps you build up healthy and effective coping techniques, grounding and self soothing exercises, and even just like a cache of positive memories that you can go to help regulate yourself. And sometimes as I'm going through resourcing with someone, I'll be like, oh, this person is not ready to do processing because we have no coping and no resources. Like we have no grounding, we have no foundation of safety,
hmm,
emotional, mental safety from which to do this very difficult, vulnerable work. But in that case, as a therapist, I would still spend a good amount of time on resourcing. We just wouldn't be getting to the actual trauma processing yet. But
hmm.
you can absolutely benefit. And I've worked with some people who needed 6 months to a year of resourcing
Oh,
before we could do trauma processing. Now, these are people with highly complex trauma that, you know, just were coming in kind of at zero in terms of ability to tolerate the processing. But just because you're not focusing on the trauma itself doesn't mean you're not doing really important, powerful work. I
hmm,
mean, if you just had, you know, 45% more coping ability, I think you would feel better, right? It doesn't,
yeah.
you would still have some triggers, but there's still a overall like very positive impact that that therapy would have on you. So that would be my response to that. If your EMDR therapist says, "Oh, now is not the time for EMDR," and they're not suggesting just doing copious amounts of resourcing,
Mhm.
I would get curious why.
Yeah.
Now, we know that sometimes there are genuine safety concerns, right?
Mhm.
Like if coming to therapy puts someone at risk, like if an abusive spouse is going to find out and retaliate,
Mhm.
we certainly don't want a client to be in more danger because they're seeking services. We know that when people leave, the risk of violence goes up exponentially.
Yeah.
So that's very real, and a therapist should be aware of that and kind of factor that into treatment timeline. Um, but yes, absolutely. Sometimes it's not the right time for the trauma processing, but there's plenty of other stuff you can do.
All right. Well, that's really good to know, and I'm glad. I always take notes, so
Mm-hmm.
I've learned a new term, resourcing,
Mm-hmm. Yeah.
which
And I
isn't just
even have an
sending you to other
exercise.
people.
We can do a resourcing exercise right now for people
Okay.
who are in the live stream or are watching later. And that is to just think of a really calm place. It can be a real place like grandma's kitchen, you're baking cookies, or a fictional place. I've had people say Hogwarts, which Hogwarts seems very stressful to me, but some people it's their calm place, right? So you
Okay.
just go to a calm place. I hear the beach a lot.
That
Um,
was that's
yeah, yeah. And just go and be there at the beach in your mind, right? And hearing the sounds of your calm place. What's the weather like? What is the air like? Are you there with people or pets, or are you on your own?
Mhm.
You can mentally go to this place anytime. If you want to get a little curious about the bilateral, you could even do some tapping as long as you're not like driving or, doing something
Right.
right now as you're listening or watching this. And you feel a shift in your body, right? So you think of, okay, next time I get triggered, I'm going to remind myself to go to calm place, as long as you're actually physically safe.
Yeah.
Don't do this if you're not physically safe. And just see what it can do to help re-regulate you and get you back down to your baseline.
Yeah, it makes a lot of sense
Mm-hmm, mm-hmm.
because you don't have to physically be there, but your brain
Yeah,
can imagine you being there.
yeah. The same way your brain imagines you're back at the upsetting memory. you
Yeah.
can you can use the same process to kind of hack your own mind and induce calm.
Yeah. That's great. All right. So, any other tips in terms of I'm dealing with trauma? My ex is
Yeah.
terrorizing me in the legal system.
Mm,
I don't know what to do.
yeah.
I could do EMDR, but any other ideas?
Yeah. Well, so everyone in my practice, we operate very holistically and we have an integrative approach. So that means we're not just looking just at the trauma, we're looking at a whole picture of you. And I like to say there's four layers. There's the like medical and health layer. So like taking care of your medical physical health, right? If you have medical care available to you, like go get some routine lab work done, like rule out anything organic, like a thyroid condition, right? Because you're in a very stressful situation. We want to make sure there's not like an extra weight on top of that
Hmm.
is a medical condition that could be treated. And then we look at your behavioral health, which is all the things you're supposed to do for yourself. The second layer, behavioral health, it's sleeping enough? Are you eating, 3 meals a day? Are they nutrient dense meals that are also pleasurable because food needs to be fuel and pleasure? Um, Reducing your substance use. We know that substances work quickly, but in the long term, they're a net negative, right? So trying to cut down there. And sleeping, protecting your sleep. I know sleep gets disrupted for a lot of trauma survivors,
Oh,
but doing what you
absolutely.
can to support healthy sleep.
Hmm.
My number one tip there for healthy sleep: find somewhere else for your phone to sleep. Put your phone in another room. You will
Okay, let
sleep
me ask
better.
you something. So, my brain is
Uh-huh.
always whatever, but
Uh-huh.
when I can't sleep, I put on an audiobook
Ah.
like really
Uh-huh.
slow and for
Ah.
15 minutes, and it helps me go back to sleep.
Uh-huh.
Should I
Sure.
not be doing that?
Oh, that's fine. I think
Okay.
that as long as people just the thing is, people, they wake up and the first thing they do is reach for their phone, and that
Mhm.
just gets your cortisol levels like flooded, right? If
Yeah,
you
yeah,
give yourself more of a slow on ramp, either in the middle of the night or first thing in the morning, your body will thank you for it. You'll also probably go to sleep earlier because you're not just scrolling,
yeah.
right?
Okay. Yeah.
Yeah,
No, I see. So it's not just
yeah,
like the phone, it's no scrolling and like
yes, yeah.
I
Just
need
some
some other
boundaries.
voice in my head than my own brain spinning.
Totally. And that's
Slow
fine.
down.
That's fine. That's fine. I hadn't heard that one before. That's great. Okay, so that second layer is like behavioral health, like
Mhm.
all the things we know we're supposed to be
So all
doing,
of
but
that's behavioral. I wasn't sure if
all
the
of that's
substance
behavioral.
is,
Yeah.
oh my gosh.
The
Okay.
things we know, well, we're looking at like input, like body input
Okay.
and like and movement, right? We talked about movement before. That's in that behavioral health layer. And you can spend a lot of time like making adjustments in the behavioral health layer,
Yeah, I bet.
with movement, substance, exercise, like sleep, nutrition, right? Substances. The third layer is deep loving relationships, right? We know that the biggest outcome of the best predictor of health is deep loving relationships. These don't need to be romantic. They can be family, they can be friendship, they can be pets. But we do want some humans in there too.
Mhm.
And a lot of adults have trouble making friends. Like
Yeah.
it is really hard. Um, I have found my number one tip for like starting to make friends is to look for people that are in transition, people that
Oh, I've
are,
never heard that before.
yeah, people that started a new job or just moved to a new city, just had a baby, just got a divorce. Like these big life transitions, people tend to be more open to new friendships in their life.
Wow, that's
And
totally different than
yeah,
find people who have things in common with you.
yeah. I mean that too, but it's not just common interest. It's like, are they kind of open and in an expansive or vulnerable part of their life? I recently had someone that I knew from a music group that I'm in. She called me and asked for divorce lawyer recommendations. So she knows I'm a therapist. And I was like,
Mhm.
oh, she wants to be friends. So I was
Oh,
like, okay, like let's get
interesting.
together and talk about it over dinner, right? It was an open door.
Uh-huh.
So
Oh, I love that. Oh, I'm going to
yeah.
use this.
Mm-hmm.
This is
Mm-hmm.
so helpful. Thank you so much for that one in
Yeah.
particular.
Yeah. Yeah.
Great one.
And I also will remind people on that deep loving relationship category, like you go slow in new relationships. We don't
Mhm.
trauma dump. And I know that when you're going through a really horrible experience, like you just need support, and it can be really hard to pace things. And just
Mhm.
remember to like just be mindful of pacing, right?
Yeah.
In these newer friendships and in existing friendships. Like you can absolutely deepen existing relationships, but you don't want to just kind of emotionally vomit on people.
Yeah,
Yeah.
that's obviously an issue with our
Yeah.
clients too. You
Yeah.
can imagine.
Yeah. And then the final layer of health is some people call it the spiritual level. I don't love that word because I think a lot of people that aren't religious or spiritual just kind of like check out. I
Mhm.
like to view it as like personal values and meaning making,
Okay.
and really having a solid sense of what your values are and using them to make decisions and using them to like maybe reallocate some of your time. If you are someone to whom activism is very important, but you're not finding a way to actually live out that activism, you're going to feel better and healthier if you find a way to do it in a sustainable manner.
Mhm.
It could also be like my values are family. And as I'm going through this crazy transition, I actually think I'm going to move back to where my family lives, right?
Mhm.
That having just a really solid sense of your personal values, a lot of people don't consciously understand what their values are. But if you go
Yeah.
on and like, if you Google a list of like, you know, personal values, like they're going to come, there's going to be an actual list on the internet and you'll look through and I think you'll have a sense of what resonates with you and what doesn't. And then you can actually concretely be able to say, oh, my values are adventure, humor, compassion, and self-forgiveness, right?
Mhm.
Okay, great. Now you use those to inform your choices going forward. So
You
so
know,
these four layers, the
I was
physical health. Yeah, go ahead.
before you continue, so the thing
Yeah.
about personal values, when I finally got out of my own relationship, I don't I think I think as you're describing it, I was doing this without realizing it. So I went on a dating app for the first time, and I was with my ex for 20 years, and so I thought this
Mm.
is going to be so cool, but I got to do a profile, and then I made a list of the qualities that I
Mm.
like in a person. So it wasn't the same
Mm-hmm.
as personal values, but some of it fit, like the humor,
Oh yeah.
flexibility, somebody who's capable of having close, loving, long-term relationships with
Mm-hmm.
others. And as I read through it, I was like, how did I end up with this person for 20 years who doesn't
Mm.
even fit in those values? And then I
Yeah.
actually met my current partner, who's the male half of Been There, Got Out, Chris, and we've been together
Mm.
for more than 10 years. But I felt like I never thought about my personal
Yes.
uh, values or like what I like in
Yep.
another human being. It was mind blowing, just
Mm-hmm.
that alone. So I think what
Mm.
you're describing is extremely important moving
Yeah.
forward to like pause and think what's important to me in another human being and for myself.
Absolutely. And, this very much aligns with like Maslow's hierarchy of needs. But I think that sometimes, even when we don't have the loving relationships totally figured out or the behavioral health totally figured out, I think we often do have a sense of our personal values. And for some people, that is actual organized faith. And for
Mhm.
other people, it's not. So just having like a very expansive category for that like final layer,
Mhm.
I think is really important. For some people, their values are kind of encapsulated by faith, and for some people, it's really personally designed.
Yeah. Oh,
Hmm.
so helpful. Well,
Hmm.
Laura, I know we've taken a bunch of time already, but I
Yeah.
really appreciate your coming on. Can you tell people how to find you?
Yeah. So my Instagram handle is linked here. We don't really connect with clients on here because it's public and
Mhm.
not HIPAA compliant. But the best way to find us is at laureltherapy.net. We have a really easy inquiry form that you can just, if you want to just talk to one of our therapists for 20 minutes, see if it's a good fit, if you're in one of the states that we serve. Those intro calls, they are directly with our therapists. It's not some admin and not a call center. And to
Wow.
get a sense of if we're the right fit, we're happy to chat with people. So yeah, laureltherapy.net.
Wonderful. Oh my gosh. Thank you so much. I've taken notes. I'm like scribbling off the paper and I want to, I think I'll do a little recap after this to see if people can come and watch this interview because I think it will be really, really valuable for them.
Yeah, I hope so. And thanks everyone for tuning in. Thanks for having me,
My pleasure.
and happy to be here.
All right. And let's stay in touch for sure.
Yeah.
Okay. Bye, Laura.